Hi guys, welcome to another video and welcome to my channel. If you are a new person on here, please do hit the subscribe button and be part of the Nestle channel. If you are someone that is interested in finding out what the healthcare system looks like in South Africa, or to even experiences in the shoes of a nurse. So yeah, on today's video, it's more of a health education video that I would like to conscientize people who are living with HIV on the things that they need to be aware of, or the things that they should be engaging their healthcare practitioner whenever they go for consultation. So yeah, let us get into today's video. Okay, I am not going to talk about someone who is a newly diagnosed, okay? If you guys would like me to do a video on someone who is a newly diagnosed, because being a newly diagnosed, there is a lot of things that goes into it. There is shock from the patient, and there is a lot of paperwork from the nurse. So I think that would require a video on its own. But this video, I wanted it to focus more on someone who is diagnosed, has been initiated on treatment, and who is basically living with HIV or has been living with HIV. So the number one thing that you need to find out when you go into a consulting room to meet up with your nurse is the treatment working for you, like the regimen that you are in. So when I talk about regimen, it's basically me saying types, like the type of ARV that you are taking. Is it working for you? Is it the regimen that you're supposed to be in? So we've got regimen 1 and regimen 2. Regimen 1 is the type of treatment that we mostly start our HIV positive people on, and regimen 2 is a regimen that we use whenever regimen 1 fails. When does regimen 1 fails? Regimen 1 fails when there is what we call virological failure. Regimen 1 fails if the patient consistently default regimen 1. I think I mentioned this on one of my videos, that we have people that will come into the treatment and out of it as soon as they see themselves picking up some weight and looking a little bit better. And when they start falling sick again, they come back to the clinic. We initiate them on the same regimen again, and once they pick up again, I have a client that does that. And these are the patients that eventually regimen 1, it fails on them. Basically, it causes resistance in the body, like the body now starts resisting regimen 1, and regimen 1 tends not to have an effect on their system. That's what causes us to move a client from regimen 1 to regimen 2. The other thing that would cause someone to move from regimen 1 to regimen 2, a client that has virological failure. So basically, the body automatically resists regimen 1. The patient takes treatment, the patient follows protocol, the patient does everything that is required of them, but still regimen 1 is not working for them. Then we move them to regimen 2. So you need to find out if your treatment is working. And how can you do that? You need to know what your blood results were, your previous blood results. If you collected bloods, or if they collected bloods from you last month, you make sure that the following visit you find out what your blood results are. Normally, on a patient that is not a newly diagnosed, that is on first regimen, we yearly collect 2 tubes. These are the specimen tubes that we use in terms of collecting bloods. This particular specimen tube, it is used to collect your viral load. What is a viral load? A viral load is the amount of virus copies that are detected in your blood. So we often take viral load, and we also take creatinine. Why do we take creatinine? This is the creatinine specimen. Creatinine, we are basically checking the glomerular filtration rate, if your kidneys are functioning well. Why do we check kidneys? I'm still gonna come back to viral load, by the way. Why do we check kidneys? There is a drug that is called tenofovir. That drug can be a little bit harsh on the glomerular of your kidneys. So we often have to check if the filtration rate is still what is within the normal ranges. I'm not going to share with you guys the normal ranges right now, what you can do is to ask your registered nurse or your doctor what are the normal ranges. One thing I always emphasize to my patients is that you ask your nurse what are your results saying, and when they are saying they are normal, you ask them what does normal mean. They need to take out the result paper and show you what do they mean when they are saying your results are normal, your results are good. When they are saying your glomerular filtration rate is 60, what are the normal ranges? Where are you exactly? So those are the things that I often emphasize to patients, that you need to ask your nurses about your results. They take bloods on your previous visit. Next visit, make sure that you inquire about your results. Your results are not for your healthcare worker. Your results are meant to also be for you, and for you to be able to have a clear picture or a clear mind of how your health journey is playing out. So let's go back to the viral load. The viral load is for us to check how many copies of virus are detectable in your system, right? You guys know that people have a tendency of like being tested for HIV, testing positive, taking treatment, and then after a while they go and want to test again, and the test normally comes back negative, and that particular person would think that they are HIV negative. No, they are not HIV negative, but they are undetectable. When we are saying undetectable, it means the virus is in your blood, but it is in so little copies that are active, but so little copies that are active in your blood to a point where we are unable to detect them. They are there lying low, we just cannot detect them with the type of test that we do in the laboratories. So viral load is for us to check if the patient is suppressing the virus. That is the main reason we are taking ARVs. We take ARVs so that the virus in our body can be suppressed. The language that I used with my kids are basically the patients that are under 15 years. The language that I use for them is that the virus is sleeping. So we are taking blood so that we can see if the virus is really sleeping. So suppression means sleeping. It means the virus is weak in your body, and when the virus is weak in your body, it means your CD4 count, it becomes strong, it multiplies and it grows. Sorry about that, my SD card was full and I had to delete like previous footage that is stored on my SD card. I don't know why didn't I delete that. But what I wanted to say about the viral load is that, where was I? Oh, as I was saying, like when I communicate with my kids and explain their results to them. So I normally do that. I know you're probably thinking, you explain results to a 4-year-old? Yes, I do. Children who are living with HIV, I treat them with the same respect I use on the adults that are living with HIV. So whenever they come back to the clinic, I need to tell them that, oh, guess what? You remember the last time I had to prick you? I mean, kids need to understand, why do I inject them with needles? They need to know, where am I taking their bloods? I don't want them to think, but there is a nurse there at the clinic that keeps on taking my blood, and they start thinking and assuming that we are vampires. So every time before I can take bloods in a 4-year-old, in a 5-year-old, in a 6-year-old, I explain to them, why do I have to take bloods? Because there's a program. There's just a lot of information, and it keeps on like coming back. So the reason I have the ability of talking to like a 4-year-old and a 3-year-old and a 2-year-old about HIV and them understanding me is because I've been trained on a course that is called Kids Alive. So Kids Alive, it helps us to use baby language or kids language to communicate about HIV and the kids' status. So I have the ability of telling a child that they are HIV positive, or there's a virus or a germ in their body. We call it a germ in their bodies, and what it does, I have that ability of communicating with a child. So it's also important for me to explain to them that, you remember the last time you were here, I explained to you that you have a germ in your body. So I need to check if the germ is sleeping. So sleeping means suppressed, and then dead means cured. So I make sure that the kids understand that HIV is not something that can die. You can't cure it, but it's something that can sleep, meaning suppression. So I would tell the kid, oh, you remember the last time me and your mom, we told you that there's a bacteria that stays in your blood. So I need to prick you with a needle, collect a bit of your blood and send it to the laboratory to see if the germ is sleeping or if it's not sleeping. So my kids understand that if the germ is not sleeping, then it's going to attack their soldiers being CD4 count. So you also need to explain to patients that if you don't take your treatment, it simply means that the virus is going to grow bigger and bigger, and it's going to feed on your CD4 count. So basically that happens. The virus grows and then it feeds on your CD4 count. Your CD4 count drops, your virus goes up. Your CD4 count drops, the virus goes up. So the relationship between a CD4 count and a virus is that they cannot stay on the same kraal and grow together at the same time. When one goes up, the other one goes down. So when the virus goes down, when the virus is suppressed, the CD4 count goes up. Automatically, you are a healthy person. So it's the same thing. You need to find out from your nurses if you are suppressing, if your viral load is suppressing, if your kidneys are functioning well. I emphasize to my patients, all my patients, not just patients who are living with HIV, but also chronic patients, also patients who come with minor ailments. Even to myself, I emphasize to myself that drinking water is significant. The people that gets to go to dialysis each and every single month, week, or whatever the frequency is, they were once like me and you. They were once as healthy as you and I are, but at some point they were just not taking a lot of water. They were just drinking a lot of things that had toxicity, and that toxicity dealt with their kidneys. So it's also important to emphasize to patients that drink water. Patients who are on tenofovir need to drink water. Please, guys, let us learn the names of the treatment or taking. You can't just say I'm taking ARVs. You need to know which ARVs you are taking. I know, Okba, the words are difficult. Trust me, even myself, when I was getting at nursing school, the words were just crazy. But when you get a healthcare worker, ask them, what treatment is this? What am I drinking? What are the names? Learn your treatment, know the type of medication that you are taking. To patients who are not literate, patients who cannot read, I normally show them the grams, like the milligrams that are written on the container of their tablets. For them to just familiarize themselves, to like have one particular thing that can help them recognize, oh, this is indeed something that they are drinking. So if you are on tenofovir, you definitely need to drink water to cleanse your kidneys. Remember, by kidneys, the function of the kidneys is to filter what the body needs and return it back to the system and excrete whatever the body does not need through urine and through feces. So if your kidneys are damaged, it means you are going to lose some of the nutrients, some of the good stuff that your body needs, and sometimes even the bad things that your body does not need, they won't be excreted, but they will be sent back to the system, and then that's where you now get to have a system that collapses. That's how dangerous renal failure is. What I wanted to say to people who are living with the virus is that make sure by your consultations with your healthcare worker are interactive. It shouldn't be a thing of you come in, the sister writes or the doctor writes, prescribes, gives you the medication, you leave without having a conversation about how you are doing, how is your health journey, their advices and their input on some of your lifestyle decisions. Have a discussion and find out how can you do better if you are not doing better, if you are not suppressing. Find out from them if it's if it's anything that you are doing wrong, or if the treatment is not working for you, and find out what are your options. So yeah, that's what I wanted to share today with people who are living with HIV. And if you guys are having any questions on anything relating to this topic, go ahead and drop them down below. And if you feel like you need a little bit of privacy, then watch this video and do take my social handles at the end of the video and inbox me in any of my social media platforms. Somebody asked me if my patients have recently reported any weight gain on the new drug that is called dolutegravir. I think I started rolling out dolutegravir in my clinic at the beginning of this year. Yes, I have had patients who were coming to me and saying the drug is making them to have a lot of appetite. So dolutegravir is a new drug to anyone who doesn't know what dolutegravir is, but it's a new drug. We got it last year, September, in South Africa. And it works way faster than efavirenz. So on the new drug, on the new combination, there is amitriptyline, tenofovir, which is the one that I was talking about with in relation with the kidneys, and then there is dolutegravir. On the previous or the old combination, we have amitriptyline, we have tenofovir and efavirenz. Actually, on DTG, I think we have lamivudine, which lamivudine and amitriptyline are actually the same thing. They do the same thing on the HIV pathophysiology situation. So the difference now between the previous regimen and the current new one is just the dolutegravir and the efavirenz. So yes, I've had patients that comes in and says that they're having a lot of appetite since they started drinking dolutegravir. So it wasn't necessarily a complaint to them. I think most of the patients that have brought that up to me are patients who were generally like slender people, slim people, and they wanted to gain the weight. So I know that it increases appetite. I wouldn't say it makes weight gain, but the eating is what causes the weight gain. But it's quite a good drug. Obviously, it makes the neurotubal defects on pregnant women on first trimester. But besides that, it's a beautiful drug. It's an amazing drug. I love it. So yeah, that's all that I have for you guys on today's video, and I hope you did learn something, and I hope you find it informative as well, and you would share it with someone who is living with HIV, just to conscientize them about their visits to the clinic. Let them not be in vain. Let them not just be about them collecting their treatment and drinking it without knowing why exactly are they drinking it. Are they achieving their goal? Are they becoming better at whatever goal it is that they are drinking their treatment for? So yeah, we'll see you guys on my next video. Please subscribe to my channel if you haven't already. I love you all so very much. Bye guys.